Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, Dr. Lee. Thanks for taking the time to see me today.
Good afternoon, Jason. I'm Dr. Emily Lee. I'm happy to help. Please tell me what's been troubling you.
I've been having severe back pain, mainly in my lower back. It's been getting worse over the last couple of weeks, and sometimes it shoots down my legs.
I see. Can you describe the pain in more detail? Is it sharp, dull, or more of a burning sensation?
It's usually a sharp pain, especially when I bend or lift anything heavy. The pain radiates down to my legs, mostly on the right side.
Do you feel any numbness or tingling in your legs or feet?
Yes, sometimes my right foot feels a bit numb.
All right. Have you had any recent injuries, or have you experienced this type of pain before?
No recent injuries, but I did have a herniated disc about 2 years ago.
That could be related. Do you have any difficulty controlling your bladder or bowels?
No, nothing like that.
Have you tried any treatments or medications for the pain?
I've tried over-the-counter painkillers and some stretches, but they don't seem to help much.
Thanks for sharing this information, Jason. Do you have any history of arthritis or other joint issues?
My dad has osteoarthritis, but I haven't had any joint problems before.
Do you have a physically demanding job or any hobbies that involve a lot of lifting or bending?
I'm a carpenter, so I do a lot of lifting and bending on the job.
That could definitely be contributing to your pain. How long have you been in this profession?
I've been a carpenter for about 15 years now. It's always been pretty physical.
I see. Have you ever had to take any extended time off due to injuries before?
No, nothing serious. I've had minor strains, but nothing that needed long-term rest.
Do you smoke or drink alcohol?
I don't smoke, but I have a couple of beers on the weekends.
Have you had any recent weight loss or changes in appetite?
I haven't noticed any changes in my weight or appetite.
All right. Based on your symptoms and history, it sounds like your herniated disc might be causing your current pain, possibly with sciatica. I recommend doing some imaging studies like an MRI to get a better look at your spine.
Do you think I might need surgery?
It's a possibility, but we'll try to start with more conservative treatments like physical therapy and pain management. Surgery is usually considered when other treatments don't provide relief.
Okay, I understand. I'd like to avoid surgery if possible.
Of course, we'll do our best to explore all options. Sometimes lifestyle changes can also help alleviate back pain. Have you noticed anything that seems to make the pain worse or better?
Well, sitting for long periods definitely makes it worse. Standing up or lying down sometimes helps, but not always.
Have you tried any other forms of relief like heat or cold therapy?
I've tried ice packs and they help a bit. I haven't tried heat yet.
It might be worth trying. Sometimes alternating between heat and cold can provide relief. We'll have you consult with a physical therapist who can guide you through exercises and techniques to help with the pain.
Okay, I'm willing to give that a try.
Do you take any other medications regularly, like for high blood pressure or diabetes?
No, I'm not on any regular medication.
That's good to know. Are you able to perform your usual work tasks, or has the pain been affecting your productivity?
It's been affecting me at work. I've had to take frequent breaks, and lifting heavy materials has become really difficult.
I understand. It's important to avoid worsening the injury, so it's good that you're being cautious. The MRI will help us see the extent of the issue, and we'll work from there to find the best solution.
Thanks, Dr. Lee. I really appreciate your advice.
You're welcome, Jason. We're here to help you find relief.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, doctor. I've been experiencing severe stomach pains and consistent diarrhea for the past 2 weeks, and it's getting unbearable.
Good morning. I'm sorry to hear that. To understand your condition better, could you describe where exactly the pain is located, and if you've noticed any blood or unusual colors in your stool?
The pain is mostly in the lower abdomen. Yes, there's been some blood, and the stool is unusually dark. I've also been feeling unusually tired and weak.
Have you experienced any recent weight loss, fever, or night sweats along with these symptoms?
I've lost a few pounds without trying over the last month, and I do feel feverish at times, especially in the evenings.
Given these symptoms, we need to consider a few possibilities, including inflammatory bowel diseases like Crohn's disease or ulcerative colitis, and even colorectal cancer. Have you had any previous digestive issues or diagnoses?
No previous diagnoses, but digestive issues have been a problem on and off for years. I just thought they were due to stress or my diet.
It's important to assess both your diet and stress levels, as they can impact conditions like these. What does your typical diet look like?
I eat out a lot, usually grabbing fast food due to my job's demands. Not a lot of fruits or vegetables, mostly just meat and starches.
I see. A high-fat, low-fiber diet can exacerbate digestive issues. We'll need to adjust that, but first we need a clear diagnosis. I'll arrange for some tests, including a complete blood count, stool test for occult blood, and a colonoscopy to get a better look at your colon.
That sounds serious, doctor. How soon can we get these tests done?
We can start the blood and stool tests today. I'll schedule a colonoscopy as soon as possible, depending on the availability. Meanwhile, try to adjust your diet to include more fiber and less processed food.
Okay, I can make those changes. Are there any medications I should start with immediately, to help with the pain and diarrhea?
I'll prescribe an antispasmodic for the pain and an antidiarrheal for your symptoms. However, it's crucial we don't mask the symptoms too much before the colonoscopy, as we need a clear understanding of your natural symptom pattern for accurate diagnosis.
Understood. Is there anything else I should do or watch for?
Monitor your symptoms closely. If you experience increased pain, more bleeding, or if you become dizzy or faint, you should go to the emergency room immediately. These could be signs of complications like a severe infection or a perforation in the intestine.
I'll keep an eye on those. Thanks for your help, doctor. I hope we can get to the bottom of this soon.
You're welcome. We're taking all the necessary steps. Make sure to keep your follow-up appointment after the tests, where we'll discuss the results and next steps in detail. Managing your condition will be a priority.
Thank you, doctor. I appreciate your thorough approach.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
We have Mrs. Smith on the schedule for an elective knee replacement next week.
Right. Has she completed her preoperative evaluation?
Yes, and everything looks good. She attended the pre-op education class and her lab results are normal.
Good. And does she have her post-op care in place?
Yes, she's arranged for home health support for the first few weeks. She also knows what exercises to do and what medications she'll need.
Great. We should also remind her to follow the mobility guidelines closely to prevent blood clots and other complications.
Absolutely. I'll make sure to go over those details with her one more time before her surgery.
Now look at question 26.
Dr. Patel has brought up the importance of early screening for colon cancer in our community.
Yes, he's mentioned it in several meetings recently. He wants to increase awareness about the benefits of early detection.
It's crucial, especially since many patients avoid screenings out of fear or misinformation.
We should aim to provide clear information about the procedure and emphasize that early detection can significantly improve outcomes.
Agreed. We can start by organizing a community education session to address common concerns and explain the process in simple terms.
That's a good idea. We could also partner with local organizations to reach a wider audience.
Let's plan to meet with Dr. Patel to discuss our strategy and identify key areas to focus on in our outreach.
Now look at question 27.
We need to discuss Mr. Johnson's diabetes management. His blood sugar levels have been fluctuating quite a bit.
Yes, I noticed that. He seems to be having trouble sticking to his meal plan, and it's affecting his blood sugar levels.
He mentioned he's struggling to keep up with the dietary changes recommended. Do you think it's time to involve a dietitian?
Absolutely. It could also be beneficial to review his medication and see if an adjustment is needed. But a dietitian could definitely help him get back on track with his diet.
Agreed. I'll arrange for the dietitian to meet with him, and we'll reassess his medication regimen after that.
Now look at question 28.
How are we handling Mrs. Anderson's discharge plan? She's been in the rehabilitation unit for quite some time now.
She's made significant progress in her mobility, but she still needs assistance with daily activities.
We should involve social services to see if she qualifies for in-home support, or if she needs to transition to an assisted living facility.
I agree. She has a supportive family, but they mentioned that they can't provide 24/7 care.
We'll need to schedule a meeting with her and her family to discuss the best options for her care after discharge.
Let's coordinate that and ensure we have all the necessary resources in place for her transition.
Now look at question 29.
Ms. Brown seems to be responding well to her physical therapy. She's steadily improving her range of motion.
Yes, I've noticed that too. She's been very dedicated to the exercises, but she still has some stiffness.
Perhaps we should consider introducing aquatic therapy into her routine. It could help improve her flexibility without putting too much strain on her joints.
That's a good idea. The buoyancy will help relieve some of the pressure she's feeling. I'll talk to her and see if she's open to the idea.
Great. If she agrees, let's coordinate with the aquatic therapy team and get her started as soon as possible.
Now look at question 30.
Mr. Edwards is getting discharged tomorrow. Have you ensured he has all the medications he needs for home?
I've checked his prescriptions and made sure everything is up to date. The pharmacy has already prepared the medications.
Good. And do we have all the follow-up appointments arranged?
Yes, his first appointment is scheduled for 2 weeks from now, and the rest are spaced out accordingly.
Perfect. Let's make sure he gets a clear set of instructions on wound care and a list of symptoms to watch out for. It's crucial to avoid any complications.
I'll go over everything with him thoroughly before he leaves. We want to ensure he has all the information and support he needs for a smooth recovery.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Ladies and gentlemen, a very warm welcome. I'm Dr. Michaela Waters, a public health specialist, and today we're diving into an increasingly important issue, mental health among adolescents. Picture a typical teenager. Let's call him Alex. He's 16, an age characterized by a whirl of emotions, friendships, and the pursuit of identity. But lately, Alex hasn't been feeling like himself. He struggles to find joy in activities he once loved. His grades are slipping, and he feels isolated, unable to connect with others. After much reluctance, Alex reaches out to the school counselor, who listens to his struggles. Together, they realize Alex is dealing with depression, a reality far too common for many young people today. In fact, studies indicate that 1 in 5 adolescents has experienced a mental health disorder, with depression and anxiety being the most prevalent. The journey Alex is on, while personal, is part of a broader story that involves societal pressures, social media influence, academic stress, and family dynamics, all of which can exacerbate mental health challenges. Adolescence is a critical period where many mental health issues first emerge, and if left unaddressed, they can have lifelong consequences. There are several layers to consider in this situation. First, the environment. Young people today navigate a world of constant digital connectivity that amplifies feelings of inadequacy and isolation. The pressure to succeed academically and socially is immense, and many struggle to cope. Second, access to care is a significant issue. Even when young people like Alex recognize that they need help, stigma and a lack of resources can hinder them from receiving the necessary support. Mental health services in schools are often underfunded, and many adolescents lack access to specialized care due to financial barriers or geographic isolation. Third, education plays a pivotal role. There's a need for greater awareness among parents, educators, and adolescents themselves about the signs of mental health issues and how to address them. Breaking down the stigma surrounding mental health can encourage more open discussions and foster supportive environments. Addressing adolescent mental health requires a comprehensive approach. Schools can play a vital role by incorporating mental health education into their curricula, training staff to recognize early warning signs, and ensuring counseling services are readily available. Additionally, communities can establish youth support programs that offer safe spaces for young people to express themselves and connect with peers facing similar challenges. On a policy level, increasing funding for mental health services and improving access to care is crucial. Telehealth services can bridge gaps, providing adolescents in remote areas with the support they need. Expanding insurance coverage for mental health services can also remove financial barriers for many families. Moreover, we must leverage the power of technology positively. While social media can contribute to mental health issues, it can also be a platform for spreading awareness and offering support. Online resources and apps designed for mental health can help young people access information and assistance discreetly. Alex's story is just one of many. Adolescence is a vulnerable time, and it's crucial that we address the mental health challenges faced by young people today. By fostering supportive environments, increasing access to care, and promoting open discussions about mental health, we can help adolescents navigate this challenging period and equip them with the tools to thrive.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
The rising prevalence of non-alcoholic fatty liver disease, NAFLD, is a pressing concern in contemporary healthcare, affecting millions globally. This condition encompasses a spectrum ranging from simple steatosis, or fat accumulation, to non-alcoholic steatohepatitis, NASH, characterized by inflammation and damage, which can progress to cirrhosis and liver cancer. Given its strong association with metabolic syndrome, NAFLD has emerged as a leading cause of liver disease worldwide, warranting comprehensive understanding and strategic management. NAFLD is primarily driven by insulin resistance and obesity, conditions that disrupt lipid metabolism, leading to excessive fat deposition in the liver. The increasing incidence of NAFLD parallels the global rise in obesity and type 2 diabetes, highlighting the impact of lifestyle factors on liver health. Genetics also play a role, with certain populations demonstrating a predisposition to develop NAFLD even with modest weight gain. The clinical presentation of NAFLD is often insidious, with many patients remaining asymptomatic until the disease advances to NASH or cirrhosis. Symptoms, if present, are typically vague and nonspecific, such as fatigue and right upper quadrant discomfort. This asymptomatic nature underscores the importance of high clinical suspicion and routine screening in at-risk populations, like those with obesity, diabetes, or dyslipidemia. The diagnosis of an NAFLD is typically established through a combination of clinical history, laboratory tests, and imaging studies. Elevated liver enzymes, particularly ALT and AST, may suggest liver injury, though normal levels do not exclude the diagnosis. Imaging modalities like ultrasound, CT scans, and MRI can detect hepatic steatosis, but liver biopsy remains the gold standard for distinguishing NASH from simple steatosis and assessing fibrosis severity. Management of NAFLD requires a multifaceted approach, focusing primarily on lifestyle modification to address the underlying metabolic dysfunction. Weight loss through diet and exercise has proven effective in reducing hepatic steatosis and improving liver function. However, adherence to lifestyle changes remains a challenge for many patients, necessitating structured support and education. Pharmacotherapy for NAFLD is currently limited, with no FDA-approved medication specifically for the condition. However, several agents targeting metabolic pathways, inflammation, and fibrosis are under investigation. Pioglitazone and vitamin E have shown promise in improving liver histology in NASH, though their long-term safety and efficacy warrant further study. Emerging treatments focus on pathways like FXR agonists, ACC inhibitors, and anti-inflammatory agents, offering hope for future therapeutic options. Consider Maria, a 52-year-old woman with a history of type 2 diabetes and obesity. She presented with fatigue and mild right upper quadrant discomfort, prompting her physician to order liver function tests, which revealed elevated transaminases. Imaging confirmed hepatic steatosis, and a subsequent biopsy established the diagnosis of NASH with early fibrosis. Maria's case highlights the importance of screening in at-risk individuals and the need for prompt intervention to prevent disease progression. Maria's management involved a multidisciplinary approach, including a structured weight loss program and optimized glycemic control. Despite initial resistance to lifestyle changes, she gradually embraced healthier habits, leading to significant weight loss and improved liver function. Her journey underscores the importance of patient education and support in managing NAFLD. The growing burden of NAFLD calls for concerted efforts in research, public health initiatives, and clinical practice. Increased awareness among healthcare providers and the public can lead to earlier diagnosis and intervention, potentially altering the course of the disease.